TNT Open Mind Insights brings you powerful, authentic conversations, illuminating the path to better mental health care for all.
Hello,
How are you? How do you say your name?
Sharmil Shah.
Sharmil.
hmm
Shah.
Yes,
Okay. Good to meet you.
nice to meet you too.
Let's get started. You're at a point in your life where you can turn around, look back, and say, wow, have I been a long way since I started? So tell us a little bit about what started you on the path that you're on now.
Okay, happy to answer that. I started, when I was in high school, I had always had a passion for children and helping others. These were the two things that I just would find every opportunity to do so, whether it was volunteer opportunities or babysitting or anything. And so I had a great interest in a lot of science classes, so like biology, chemistry, anatomy, and physiology. And you're probably thinking, I know where this is going. That I decided to kind of take a career path to go into medical school. I wanted to
Okay.
become a doctor.
Okay.
And so I was accepted into an accelerated program at UC Riverside as a biomedical sciences major. And that was my path until I took an Psychology 101 class and
Oh,
kind of just, as part of your general education requirements.
sure.
So I took that course and the rest is history. I was hooked. I was so amazed by all the different theories and strategies and techniques, and that I decided that this is what I want to do with my life, and this is how I want to help people. And so I had come across a lot of folks in my life who suffered from mental health challenges, and it always felt like I was a good listener. I could listen to them. I understood them. I was always in problem solving mode. How could I help you solve this problem? But I always tried to look for the resources that people had within themselves to make their lives better.
Hmm.
And so this just became a calling for me that I just wanted to pursue. And so I did my bachelor's in psychology, went on for my master's in marriage family therapy, and then did my doctorate. And I specialized in children and trauma
Okay.
so that I could really support the young people. I always feel that children are our future. And I want to always ensure that they're well and able to live fulfilling lives themselves, but be contributors to our
Sure.
future.
Sure. So you could be out there now as an individual psychotherapist giving counseling and support to
Mhm.
individuals. What kind of flipped the switch for you and caused you to go in the direction that you're going in now? What was that
The
like?
From the medicine to
Well,
psychology, or
medicine and psychology,
Mhm.
but like you could be isolated in your own office
Mhm.
doing, individual therapist work,
Oh, right. Mhm.
or now you're in the world of policy making, and
Yeah,
that's a big switch. So what was that like for you?
absolutely. So I provided therapy to children and families for roughly 12 to 13 years.
Hmm.
And it was after I had my first daughter, actually, where things kind of changed for me. As you work as a therapist, you have to be self aware of your own triggers and your own understanding of the world and how working with your clients affects you. And it became very difficult because I worked with perpetrators and I worked with victims. And so it just kind of, I felt like I had reached a pinnacle where I could do all that I could do, but that I wanted to try and make a larger change. And I didn't feel I could do that as an individual clinician.
Hmm.
So that's when I decided to make a change and go into the administrative side of things. And so now I'm an administrator. I worked first with the Mental Health Services Oversight and Accountability Commission, which worked mainly with the 59 counties across the state so that I could support them in spending Mental Health Services Act dollars, or now Behavioral Health Services Act dollars. And so that was my chance to kind of make a change on a broader scale. So I was doing things locally and I was making changes in individual and families' lives, but I really wanted to take that experience and my administrative experience and take that one step further. And so that's kind of how I came to work for the state. And my current role now goes even further and goes even beyond that in the policy realm, where I'm now thinking about workforce development. So
Mm,
how the behavior, how do we now increase the number of behavioral health professionals that are so needed right now, given the crisis that we're in? And so that's kind of how it kind of the journey went.
okay. I was going to ask you what the next steps were, but you segued to the workforce issue
Yeah.
very nicely. It is really important.
Mhm.
Um, so, what role are you playing right now in
Mhm.
helping us? I know we need more social workers, we need more psychiatrists, we need more of everything. We need more peer support.
Mhm.
All these different, things that can be
Yeah.
done for people with,
Mhm.
having specialized training. So, what's the focus right now? How are you
Mhm.
making a difference
Oh, yeah.
or hoping to make a difference?
Hoping to
Right?
make a difference,
Yeah.
always
Okay.
hoping,
All
yes.
right.
So right now, again, I'm part of the organization that I work for, Department of Healthcare Access and Information. One of the most astounding things that we have done is, you know, first we need to understand the landscape. Where are the gaps? Where are we missing professionals? So we embarked on a very intense strategy around behavioral health. And so we were able to determine where the shortages are, what professions that their shortages are in, and we are using that information to now develop programming. So what we're doing is where we have grant programs, we have scholarship programs where people can apply for dollars to become either a licensed clinician or a peer support specialist or a community health worker, any of these professions. That there are many. We looked at about 14 overall professions. And so that's exactly what my focus is right now, not only for our licensed professions, but our unlicensed professions, and also incorporating SUD counselors, so substance use
Okay.
work as well. And we're also looking preventatively, because I feel like our system has been very reactive versus preventative.
Sure.
And so the work that we're doing is really kind of an upstream solution. How can we, um, like our wellness coach work, I don't know if you're familiar with that, but that is a profession in which we are working with young people. Um, in schools to provide them with a trusted adult to support them so they don't get to serious mental illness. And so that's this sort of upstream preventative solution that we're working on as well. So I'm hoping that my investment of time and expertise will help grow these professions through these programs and also support youth through this preventative
Okay. But you don't run
innovation.
around the state going to the 1,500 school districts yourself personally,
No,
right?
I don't.
So tell us a little bit more about what that's like. How do you facilitate this kind of new and exciting
Yeah.
outreach? It's a public health approach, right?
Yes,
Okay.
absolutely,
Well, tell us a little bit.
absolutely, and I think what's really important is that, and this is I truly believe, is that community engagement has been a key piece of all of this, and that's been a lot of what I have been doing. So, yeah, no, I don't go to all the school districts. I do go to some. We did a very, interesting rural site visit where we were able to talk to some rural communities about the challenges that
Mm.
they face. But mostly what I'm doing is really ensuring that education partners, lawmakers, health professionals, other entities are aware of our programs and get all the information they need that they can then talk to other students who might be interested in the profession. So we'll go to educators as well and educate them about the program.
So you're training people to be able to facilitate and connect folks with
Hmm.
services and
Yeah.
programs.
Mhm,
Okay.
mhm.
Okay. Wow. That's a big responsibility.
Yeah, and it's a
Yeah.
lot of fun. I think that, the cause is great and the need is great, and so it makes me feel very good about what I'm doing.
Okay. So what are some of the kinds of feedback that you get when you're out there doing what you do with people?
I think that the first thing they say is, "Thank you. You asked me." I think our communities have most of the answers that we're looking for. And one of the things I've really learned is that we can never make an assumption on what the community needs without asking them directly. And so a lot of them are just very happy that we've come out. They share what they feel the challenges are, especially we're hearing mostly that access to care is a big challenge, and that our youth are in crisis, and our systems are overburdened, and there's a workforce shortage. There's not enough behavioral health professionals to help us. They're not culturally competent as much as we'd like. The cost of services is high. So these are the kinds of feedback that we get when we go out into the communities and inquire about what are the challenges and what are the needs.
Okay. I'm aware, because I work with the legislature in the budget process, that
Mhm.
the HCI lost a lot of funding the last couple of years on workforce
Yeah,
force.
we did.
So you guys are resourceful, I'm sure, and you're working on hacks, right? Workarounds for
Yeah.
that kind of thing. Tell me what it's like to deal with a loss of a funding stream, but knowing you got to try to figure out some way to get out there anyway.
Yeah, the loss was great, and we had to get creative within the organization, especially within the Office of Health Workforce Development. And with that creativity, it was kind of looking at our programs, looking at the funding streams that we have, and determining, where can we either reallocate funds or how can we, work with the community. And we've had many conversations with the community when we've had these kinds of challenges to help us kind of determine how to best use these funds.
Okay. So making the most of what you do have, right?
Exactly,
Okay.
exactly.
All right. So, what do you do working with like primary care?
Mhm.
Primary care workforce is huge compared to the mental health
Yes.
workforce. Seems to me that there should be some way of working with them to bring them in and kind
Mhm.
of train them up, make them available in ways that are helpful to people's behavioral health.
Mhm. So HCI funds currently a fellowship program called Train the Trainer, so TNT Fellowship Program. And this is a program where primary care physician doctors are educated on mental health conditions and disorders and and so this is our opportunity to really highlight why the integration of primary care with behavioral health is so significant. And so through that funding, I think we've taught over 100 doctors, and that has been a very successful program. And so we're very excited about that. And we're often talking with others about how important the integration of primary care with behavioral health is as another sort of prevention strategy to um, catch things earlier
Yeah.
before they become more serious.
Yeah. Many hands make light work, right?
Yes, and
Yeah.
multidisciplinary collaboration is key, I think, to
Yeah.
helping our communities.
Yeah. That's great. So, given where you are today, where do you see the work that you're doing, being in 4 or 5 years?
Mhm,
We have challenges from Washington and uncertainty in our budget.
mhm,
And so you guys, I think, have a demonstrated track record
mhm,
of innovation. So can you tell me a little bit about your thinking as far as a little forecasting a little bit
mhm.
under those kinds of circumstances?
So, I think I don't wanna overspeak. This is probably but I do feel like in the next 5 years, if and again, as part of that strategy process, our hope is that we will work collaboratively with all other state departments, knowing that we alone cannot solve the problems of the behavioral health or mental health challenges in this state, but that we will have um, took a big chunk out of the challenge by increasing the number of behavioral health professionals in the field, and also gaining interest in individuals who want to be in the field. So opening up the opportunities to young people, starting at a young age with schools and talking about what behavioral health is and how you can get involved and how if this is a track or a career that you want to pursue, here are ways that you can do that. So I feel like our impact will I think what we're doing now will gain us more behavioral health professionals in the future. That's my hope.
Okay. All right. So, if you had one thing to change about what's going on right now, what would that be? What's the most critical thing that you would like to see a little bit different, maybe?
I think I would like to see that. Hmm, that's a good question. I think it's hard, but it's good. I think I have a wish list of things, but the thing that really keeps me up at night, I think, has a lot to do with access to care.
Okay.
If I could change that, I would want care to be more accessible, people be more empowered to seek help, so reduction in stigma, that it's more affordable, that there are behavioral health professionals out there who have the capacity to serve the needs that are happening now, and also culturally competent to meet those needs.
Okay.
So I think it would be just this picture of, ease at which an individual who needs help has clarity in how to navigate the system.
Okay. And that's often really tough because our systems are pretty complicated.
Right.
Yeah. You're dealing with some things that are frightfully important, right, to
Mhm.
people's lives.
Yeah.
They have a lot of consequence. There's a lot of weight
Mhm.
to what you do. How do you take care of yourself?
Self-care. I have a little mental health toolkit, if you will.
Okay.
I have three very important things in it. One is a meditation app.
Okay.
There are a lot of apps out there, but sometimes when I need to really center myself and sort of take in those intentional deep breaths, listening to a meditation really helps me ground me and kind of get me sort of back on track. And I also enjoy dark chocolate. Any kind of
That's
dark
great.
chocolate
I
is
I hear
very
it's very
helpful.
healthy for
Yes, it
you
is
'cause
healthy, and so when we talk about wellness, it's very healthy. And then, of course, I truly believe in physical movement, so I keep a nice, 80s playlist on my
oh,
phone. So,
okay.
that's always been very helpful. So, yeah, those are the ways that I care for myself, but also I care for myself by doing. And doing for others is my life's work.
Mhm.
And so that um,
Mhm.
keeps me well as well.
I know. I can relate to that. When my son is not doing well, at least I can be helping other people.
Yeah.
And
Yeah.
as you know, schizophrenia is a waning and really kind of relapsing kind of
Hmm.
illness. So there's always ups and downs. So
Yeah.
I can relate to that.
Absolutely.
Yeah. Where would you like to be in 10 years?
Mhm.
Are you ever going to get tired of your job?
I don't think so. I
Okay.
think that this is my passion, and I've been in different roles throughout my career in which I was helping children, I was helping families, I was helping older adults. It was kind of the lifespan. And I just never grow tired of it. So I do see myself still working in this field, contributing in the ways that I can, increasing my advocacy, and making a difference in any way that I can.
Okay. Where do we need to go as a state? What do we need?
I think that um, the state, and if we could do this more locally, it would become statewide, is that, mental health and is like it's a culture. I feel like it's a culture that needs to be developed in all of our communities where mental health education is provided, people understand mental health, they will seek the support that they need, but also that there's the opportunity for no stigma, meaning that people will actually seek out help. So I feel like we're developing a culture here around mental health and making it more accessible and making it more um, okay to reach out for help.
Part of what I'm getting from what you're saying is that we probably need to be paying more attention at the level of schools because that's a common denominator for everybody.
Yes.
So if there's going to be widespread change in a number of the ways that you've indicated,
Mhm.
is school initiatives are they the kind of thing that could help pull all that together?
It's a great start because, as I indicated, I want our system to be preventative, not reactive. And so, if we start early when mental health challenges are emerging, then we're able to catch these things sooner, and we're not having to be a burden on the system because we have now more people with serious mental illness. So yes, I think starting at the schools, recognizing, whether it's depression or anxiety or even just like preclinical type symptoms that could be coming up, and then provide young people with the skills on how to manage those symptoms. Obviously, there are going to be children who do need a higher level of care. But if we can consider this a preventative strategy versus a reactive strategy, then we could make a bigger dent in the challenges.
How do people get involved and active in the kinds of things that somebody's listening to this and they say, that sounds like just the kind of thing I want to do? How would you suggest that they go about becoming more active and becoming advocacy oriented?
I would suggest that, as I indicated before, that the community is the first place that we should start for anything that's related to program development or what does the community need. And I think that people who want to get involved should promote open conversations about mental health so that stigma can be reduced. I think they should consider advocacy with local legislators and local political figures so that they can get their voices heard. I would suggest that people get involved in community engagement or focus groups. The counties put on a lot of these kinds of events when they're looking for information about program development. Find out from your local community behavioral health office, how can I get involved? How can I contribute my thoughts and my ideas to what I hope should happen or what we think should happen? So I think those are a couple ways that people
Okay.
can get involved.
So, local departments of mental health may
Mhm.
be interning or
Mhm.
volunteering.
Yep,
Volunteering is a way to start.
yep,
Okay.
absolutely. Or again, being part of those groups and there's those community engagement meetings that they have, where again they can find out about those opportunities, but then also have a voice.
Do you have an unlimited amount of energy to do all these things, and where does that come from?
Oh gosh. Again, I think as I said in the earlier part of this conversation, that I have a passion for helping others and seeing people live their best lives or being able to change a young child's life by just teaching them a skill or helping them deep breathe through an anxiety attack is so satisfying to me. And I can't tell you, it's like energizing that I was able to change someone's life in even to me, it feels like a small way, but, I've gotten letters from parents who have said that if you hadn't taught my child how to deep breathe, I think they wouldn't have gotten through their test. And so I know some of these things seem very simple and very minute, but they are a big deal in these young people's lives. And so for me, I feel like I can't stop because I continue to make differences even in the role that I'm in now, even though I'm not providing one-to-one service anymore, or I'm not providing counseling on a regular basis like I used to. I still feel that when I see that we have over 1,200 wellness coaches in schools, that makes me feel good because now I'm thinking there are now many more kids that are going to get the help that they need or the support that they need and before anything becomes more serious. So I, I feel like I'm uh, um, contributing not only to the individual, but to our community as well. And so that keeps me going. One of the things that I do is I encourage at work site visits so that we can kind of we're funding. Let's check it out. Let's see how we're doing. And through my work, I've had not only opportunities on my own, prompting, but other state departments have invited us to come and talk about, and ask them, how are things going? Is this funding making a difference?
I have a good friend in the legislature, he used to be in the legislature, who was a pediatrician, and
Mhm.
the way he managed to stay grounded and connected to the real work, right?
Yeah, yeah.
Was actually to work Fridays at a clinic.
Oh, nice.
And so he did that for, 10 years, eight
Hmm.
to 10 years.
Hmm.
And so he always had that fresh perspective. He ended up chairing some of our committees, and that ended up being something he brought to everything that he did. So do you think you would do something like that?
I think so. That would be a great opportunity. And I also, another way I stay connected or had stayed connected and want to kind of think about getting back into it again is, I taught undergraduate psychology.
Oh, yeah.
And so that was really exciting because I was influencing the next generation of clinicians.
Yeah.
And I have my own style and my own way of working with families and children, and it's very strength based. It's looking at what, again, resources are within the child or within the family to support their wellness. And I really wanted to be a part of that next generation of clinicians that comes out. How could I influence them positively to not necessarily think just like me, but really understand that passion and that love for the
Hmm.
field as much as I have it. And I feel like some of it has. Some of the students would say, "You're very passionate about this field," and I'd say, this is my life's work. And so I was so very excited to share that with the students.
Yeah. Do you think you'd ever run for office?
Right. No, I don't think so. I think policy and politics and all of that is good. I just You kind of have to have a stomach for it, and I'm not quite there yet.
Think you found the right place to be right now. So it sounds to me like you have gotten up to a place where you can look around and you can see that maybe we're winning the war against stigma a little bit.
Hmm.
Yeah.
Yeah, I do.
Okay.
I do. I do see improvement there,
Yeah.
and thank God for that.
Yeah. Where does California fit in the larger scheme of things with all the interest across the United States
Mhm.
in mental health and substance use treatment and kids and all the things that you've been talking about?
With all the work that I've done thus far and I've seen thus far, I feel like California is ahead of the game. In the way that I say that is because our own governor has and our previous president had made significant investments in mental health. So to me, that's like a recognition that there is a need for services and a need for support for those with behavioral health challenges. And so for me, I feel like California's been really innovative. We've done so many different things with our Children and Youth Behavioral Health Initiative. We've invested millions of dollars in supporting children and families, and it's been a cross department collaboration of that is so huge because there was so much dollars that went out, but California Department of Public Health was involved, Department of Healthcare Services, HCI. So there was this multi-collaborative effort that was focused on statewide solutions. And so to me, I feel like that is, that's been phenomenal. I've heard of different things in other states. They do things differently. And not to say that California is better. I just feel like I feel like we're slowly but surely moving the needle on making a change in
Okay.
behavioral
So
health.
California is a leader
I think
in so
so.
much. We're
I think
showing
so.
the way, and other states can take advantage of
Yes,
that. Okay.
absolutely.
Well, it's been lovely talking to you. I really appreciate a lot of the stuff that you've said, and I really appreciate having met you.
Thank you so much, Randall. Same here.